Good morning, everyone.
Good morning.
Welcome to the Board of Commissioners meeting this morning. Appreciate everybody's here. It's in the boardroom and everybody else who's on virtual. We welcome you here to the meeting this morning. We'll have a public comment part at the beginning of the meeting that you can comment only on agenda items only. At the end of the meeting, we'll have another public comment where you can address the board. So with that, I want to call the meeting to order. We're going to have prayer by Commissioner Cook. I'll do the pledge of allegiance, and then we'll have a roll call by Madam Clerk.
Let's pray. Dear Lord, thank you so much for another beautiful day to come before you, make decisions for the citizens of Tuscola County. Dear Lord, just be with our first responders as they do their work today, and be with the military men and women that serve in our country too, Lord. Thank you for everything you do for us. In your precious name. Amen.
Amen.
I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
Thank you. Good morning, Commissioners.
Good morning.
Commissioner Barrios. Here. Commissioner Barba.
Here.
Commissioner Vaughn.
Here.
Commissioner Lutz.
Here.
Commissioner Cook.
Here.
You have a quorum. You may proceed.
Thank you. Okay, first thing on that is adoption of the agenda. I got a couple things that we want to do. We want to go down to number 4, and we met a prosecutor, Erica Wally, to the first on the agenda. And I'd like to take her to number 1. And then we got Carrie Taybars to come here and present. I'm gonna move her down where the prosecutor was. And just make those switches. Anything else to add to the agenda? Anybody got anything to add or any changes? Well, then we'll take a motion to adopt the agenda.
Mr. Chair, I move to adopt the agenda as presented with those two changes.
Support.
It's been moved by Commissioner Cook, supported by Commissioner Lutz, to adopt the agenda as presented with the 2 changes. Any more discussion? All in favor say aye.
Aye.
Motion's been approved. Action on previous meeting minutes.
Mr. Chair, I make a motion to move to adopt the meeting minutes from the April 16, 2026 regular meeting.
Support.
It's been moved by Commissioner Lutz, supported by Commissioner Barrios, to move to adopt the meeting minutes from the April 16, 2026 regular meeting. Is there any more discussion? Hearing none, all in favor say aye.
Aye.
Motion been approved. We have a brief public comment period. For anybody who wants to address the board on anything that's on the agenda this morning. Agenda items only, please. Any public comment this morning? Seeing nothing out there, you know? Let the record show, please, Madam Clerk, that public comment was offered.
Thank you.
And we had no participants. That will move on to the consent agenda.
Mr. Chair, I move the consent agenda minutes and the consent agenda items from the April 27, 2026 committee of the whole meeting be adopted.
Support that.
It's been moved by Commissioner Cook, supported by Commissioner Lutz. They'll move that the consent agenda minutes and the consent agenda items from April 27, 2026 committee of the whole meeting be adopted. Any more discussion? Hearing none, all in favor say aye.
Aye.
The consent agenda has been adopted. Move on to new business. And again, we want to welcome Erica Wally, the prosecutor. Who's up?
Morning.
Good morning.
And thank you for taking me out of order. I called yesterday. I'm in the middle of a jury trial right now, and I need to get back to finish that. So I appreciate that, and I apologize to anybody whose spot I took. I'm here to move the board to approve the hiring of Lori B. Selvage as the new Chief Assistant Prosecuting Attorney for Tuscola County. Ms. Selvage has 17 years of criminal law or experience in the area, 14 of which are in the area of criminal law. He graduated from law school in 2009 and was barred the same year. Because of her level of experience, I would ask the board to start her at step 6 of the chief assistant pay scale. I know that it's not normally the request that we make, but given her experience level and given the frankly dire straits that my office is in right now, and the fact that Ms. Selvage is stepping down from a position that pays her approximately $20,000 more annually than what we can pay her even at the top step to come here and be our chief assistant. I really would ask the board to consider this and start her at step 6. Ms. Selvage has worked in 3 different prosecutors' offices. She's currently a senior assistant prosecuting attorney in Genesee County. She tried 10 felony cases last year alone. And I think that she's going to be a great fit to our office. In addition, she is a Tuscola County resident, which I've talked to the board before about wanting to bring in local attorneys to staff our office. I think that will reduce our turnover rate. And I think that people who live in a rural community, understand a rural community, are the best fit for my office. So with that, I would ask the board to approve her hiring at step 6.
Any questions for Ms. Wallach?
Mr. Chair, I move to approve Lori Selvage to fill the open Chief Assistant Prosecutor's position. Ms. Selvage has 17 years of legal experience, including 14 years criminal law, wages starting at step 6 at the rate of $106,722 annually, with a tentative start date of May 12, 2026, pending a satisfactory background check and physical and drug screen.
I support.
I would note before you make your motion that that salary will be slightly different because of the 2.5%
Oh, yeah.
increase that was recently approved by the board.
Okay, do we need to get that changed in there,
I
Madam
think,
Clerk?
That should be able to be handled by HR because that would have been the prior step based
that was
on,
the step when I made the motion.
exactly, yes. So I think that'll just get handled
Do there.
subsequently after because Shelley, I believe, has to handle that through
Okay.
for all of the,
I know the
officials,
number,
but-
Shelley texted it to me, I can look it up really quick if I need it.
yeah. And if that is, if you have that, we can make the friendly amendment if
Sure.
you want.
It is $109,390.
I'm sorry, Erica, can you say that again?
109,390.
And I'll make that,
So a friendly amendment to
Friendly.
change from 106,722 to 109,390.
Correct.
And Commissioner Barrios, you're, okay, we will make that effective then. Thank you.
It's been moved by Commissioner by Commissioner Lutz and supported by Commissioner Barrows to move to approve Lori Selvage to full open chief assistant prosecutor position. Ms. Selvage has 17 years of legal experience, including 14 years in criminal law. Wages started at step 6 at the rate of $109,390 annually, with a tentative start date of May 12, 2026, pending the satisfaction background check and physical drug screen. That is the motion. Is there any more discussions? Hearing none, all in favor say aye.
aye.
Motion's been approved.
Thank you.
Thank you, prosecutor.
Okay, move back up to new business. The introduction of Christy McCowick, the new Michigan Department of Health and Human Services, MDHS.
Good morning. I'm Karen Southgate. I'm the current director for the Department of Health and Human Services in Huron, Lapeer, and Tuscola counties. And I want to introduce the incoming director, Krista Makoviak. Krista will be taking over on May 12th. My last day is May 8th, so I will be retiring after 37 years with the department. So I just wanted to take this opportunity to introduce her, and I want to thank you for giving us some time on your agenda. So we also do want to provide an update. Can I go into that?
Yeah.
All right, do they have this, Ian? Do you have this in your packets?
Should be in fact, because it was attached to the agenda.
Yeah, there it is.
Yeah.
Okay. So I just wanted to give you an overview of our three offices, and I'll just cover Tuscola, but in your packet, you should have the data for Huron and Lapeer as well. So we are a state agency, and our mission is to provide services and administer programs to improve the health, safety, and prosperity of the residents of the state of Michigan. We are a tri-county configuration, so we're with Huron, Lapeer, and Tuscola. We have 114 staff across the 3 counties. There are 25 in Huron, 44 in Lapeer, and 45 in Tuscola. We do have adult services workers also in our offices, but they're supervised regionally. I don't supervise them. Regarding our programs, we offer the Family Independence Program, Food Assistance Program, Child Daycare, State Disability Assistance. Supplemental security income I include, we don't administer that program, but I include it just for your awareness. State emergency relief, Medicaid, the Healthy Michigan Plan, and then we do help families who come to us to pursue child support assistance. So our benefits are funded federally and by the state. Eligibility is determined based on criteria set forth in federal, state policy and law. They're affected by any income or assets that an individual might have. They're affected by group size, disability, age, children in the home, etc. So the Family Independence Program, that is a cash program available to individuals with dependent children. And there has to be a deprivation factor. So there has to be an unemployed parent, a disabled parent, an absent parent. And the family also has to be referred for work. They have work requirements unless they're deferred. And the benefit for one individual, so let's say a pregnant woman, would be $363 a month. The benefit for a family of 3 with no other income would be about $583. Food assistance is a federal benefit, but we administer it through the state. And there are work requirements for people receiving food assistance. And one person with no income would receive $298, and 4 people would receive $994 if they had no other income coming in. Daycare services are available for low-income families that have a need. State disability assistance is a cash program, and that is available to individuals who are disabled for 90 days or more. And they do have to apply for some SSI, or supplemental security income, with that program. The benefit for one person is $269, and if it was a married couple, their benefit would be $423. And those cash benefits do go on the bridge card, so I'm sure you've seen the orange bridge card. They can have cash benefits on that or food benefits on that. I talk about supplemental security income. So that is a program that's administered federally, and it's available to families who have a disability, but they don't have work credits. If they had work credits, they would have Social Security. So no work credits, they would receive supplemental security income. The benefit for that individual would be $994 a month, and then there's a $14 supplement given by the state. State emergency relief, those benefits are available for individuals with shutoffs, with fire, tax issues. They need their food replaced. Recently, we had some flooding across the state. We are doing some food replacement for those individuals. Medicaid is available to individuals who are under 21, over 65, or disabled, or the caretaker of a dependent child. And then the Healthy Michigan Plan, I wanted to give you a note that the protected income level for Medicaid right now is $341. So if an individual has more than $341 income, they would have a copay or a spend down on their Medicaid. And that amount is set by the legislature. Healthy Michigan Plan is for individuals who are 19 to 64 and are able-bodied. People who are not able-bodied would receive some sort of Medicaid assistance. Healthy Michigan Plan will start having work requirements in 2027. So the next couple pages that kind of look like this, you'll see that Huron County is first and Lapeer County is second if you want to compare the counties. Tuscola County is the third page, and this is data from February. And the page I'm looking at shows our population at 52,559 at the top of the page. So we had 52 families receiving the Family Independence Program. Did you find it, Commissioner Vaughn? You good?
No.
Are you good?
Yeah, we're good. Go ahead.
Okay.
All right.
52 families receiving the Family Independence Program, and that brings about $16,700 into our community. Food assistance, we had 3,564 families receiving assistance, and that brings a little over $1 million into our community to spend at our local grocery stores and markets and farmers markets. State disability assistance, 7 individuals. In February, we helped 124 families with daycare. We had 99 families that we helped, or individuals or families that we helped with emergencies. And the estimated benefits, or the benefits that were provided to families in Tuscola County were $1,300,000 $350,000. So that amount of money came into our community, to our local stores and markets and providers. For Medicaid, we estimate about $8,800 per individual per year. And we had 10,000 individuals in Tuscola County receive Medicaid. So that's an estimated $7,400,000 coming into our hospitals and doctors. The Healthy Michigan Plan, I don't have a dollar estimate to share with you, but we had 3,000 individuals that were receiving that Healthy Michigan Plan, which is, again, is a medical benefit for individuals who don't meet Medicaid criteria. And then we had 1,270 individuals receiving SSI. So just an unduplicated total of recipients was 14,077, which is about 27% of our population receives some sort of assistance from our office. So any questions?
Any questions for?
Chairman, Karen, is this, the 27%, what's the trend line on that in the last few years compared to what you project in the future? What do you project?
We're actually down. We were upwards of 30%, and we have been trending down. So, and you can see the comparison of the other two counties as well, and they both are trending down as well.
And what would be causality?
I'm not sure.
Okay.
We also track our jobless rate, so you kind of track the jobless rate and the recipients. So I'm not sure what the trend is. I apologize.
No further questions.
Moving on, I just wanted to talk about the individual and family services that we provide. So we provide child protective services, children's foster care services, foster home licensing. We provide prevention services, trying to prevent abuse and neglect. We provide juvenile justice services, and then the adult services workers in our offices provide adult protective services, independent living services, and adult community placement. So child protective services would be if someone suspects abuse or neglect, they would call in a referral to centralized intake. And then centralized intake would look at that referral and those allegations and determine whether it meets the child protection law and whether it should be assigned out to our offices for investigation. So if, let's say, a neighbor was abusing a child, that would get referred to law enforcement, because under the child protection law, CPS only investigates abuse or neglect by a caregiver or someone responsible for the child, where a neighbor would not be responsible. So that would get referred over to law enforcement. But if the parents knew the neighbor was abusing the child and let that go on, then we would be involved, because that would be failure to protect that child. We do a lot of coordinated investigations with law enforcement. We use the Child Advocacy Center that I know you're all aware of. So lots of factors determine whether or not it gets assigned to our office. If it gets assigned to our office, we have 30 days to investigate. We go out and look at the allegations. We talk to the school. We talk to providers, service providers, and determine whether or not those allegations are substantiated. If they're not, we're going to close our case and we're going to exit the family's life within 30 days. If we have concerns that are elevated enough, we'll petition the court to get involved and have court jurisdiction. And if it's severe enough, we may petition the court to remove the children. We're always looking to place them in their community with a relative when we can. If we cannot find a suitable relative, we're looking for a foster parent in the area to try to keep the children in their communities. Foster care workers then work with the family to try to reunify them with their children as soon as possible. So we provide services like domestic violence services, anger management, parenting skills, nutrition, budgeting, try to get them connected with assistance and services from our offices to try to help them. Juvenile justice services would be in those situations where youth are making poor decisions and they might have the court involved in their lives because of some of their actions. Adult protective services would be if an individual, an adult, is being abused or neglected and they're vulnerable. So someone is taking advantage of them. And then independent living services for adults would be trying to keep individuals in their homes. So providing activities of daily living, helping them with shopping, cleaning, dressing, things like that. Adult community placement is a stipend that is given to individuals who are in adult foster care home, and it just helps support their stay in that foster home. So if you look at the next few pages, you can see Huron and Lapeer compared to Tuscola. And for Tuscola County in February, we had 81 calls to centralized intake to refer families for abuse and neglect, and 42 of those were assigned to our office. Historically, 30% of what gets called into centralized intake gets assigned to us for investigation, and about 30% of what's given to us for investigation is substantiated for abuse or neglect. We had 19 ongoing Child Protective Services cases, so those are ones that are not closed out within 30 days, but they're not severe enough to try to bring in court attention. We provide the family some long-term services, we go out and do home visits, so we just stay involved a little bit longer if they need some additional support. Foster care, we're at 15 foster care cases. No children in a child caring institution for foster care. We had 2 juvenile justice youth and 1 juvenile justice youth in a child caring institution. 7 cases were assigned for adult protective services, and we carried 197 independent living services cases. So any questions there? There's some statistics there about the importance of connecting families with resources to try to prevent child abuse and neglect, and I'll let you read that on your own. And I just wanted to comment that we do really try to make efforts to collaborate with our community partners. So we have regular meetings with TBHS, so Tuscola Behavioral Health, with the court, with the prosecutor, with our school districts, really trying to collaborate as a team, not duplicate services, share resources, and ensure that we're addressing any gaps or obstacles that individuals are running into when they try to access services from our office. And so very proud of those collaborative efforts. And we work very closely with Judge Thane and the courts. And I know that Krista and her team will continue those collaborative efforts moving forward. So I want to, again, thank you for your time. It has been an honor to work with all of you for a really long time.
Thank you for your,
Thank you.
thank you for your time.
Any more questions for Karen before you sit down? Thank you again, Karen.
Thank you.
Time served. Like, nice to meet you too, man.
Very nice.
Oh, we're good together. All right. Move on to number 3, mosquito abatement. Annual report. There is that.
Good morning.
Good morning.
Good morning, Eric.
Commissioners, I won't go through the entire report for you this morning, but I did create a highlights page for you. Please feel free to stop me at any time if you have any questions. The department employed 4 full-time and 21 seasonal positions last year, 2025. Jessica Dock joined us, as well as Jason Hall, and Chance Snyder joined us as well. Our long drive program continues to grow and is one of the most successful, popular services that we provide. This season, in 2025, there were 47 residents added to the program, bringing our total to 670 participants. Under weather data, this season indicated the county received 23.1 inches of rain. The month of June had the most rainfall with 4.77 inches of rain. March, August, and September being the driest, with an average of 2.5 inches. We officially began our season on March 31st with the treatment of all the standing water in the county, treating all those flooded woodlots. Our biology staff and larviciding crews conducted routine surveillance and treatment on 2,418 flooded woodlot sites. All of the county's roadside ditches, as well as 9 sewage lagoons, were treated during the entire season as well. Nighttime truck fogging began on May 12th. This included all 23 townships, as well as residential properties who requested adulticide treatment. In 2025, Tuscola County had 981 no-spray areas. This includes organic farms or beekeepers, as well as residents who simply do not wish to be treated. We tested a total of 112 mosquito pools in-house for disease, and 104 mosquito pools were sent to the Michigan Department of Health and Human Services. Results of in-house testing indicated 2 pools tested positive for the West Nile virus, with the results of the Michigan Department of Health and Human Services pools, 13 tested positive for the West Nile virus. The predominant presence of the West Nile virus were apparent this season, with 16 positive results that included 1 bird, 15 mosquito pools. Postseason, at the end of October, beginning of November, we were notified from the Michigan Department of Health and Human Services that we had 2 human cases that were reported last season. Just a little note on our human cases. When the Michigan Department of Health and Human Services contacts us about this, that's all the information we are provided. Due to the privacy of these individuals who contract this virus, we're given very limited information. I would like to see that changed. I do understand the privacy issue. However, I would like to pursue and possibly get something, some kind of form, general form that could be issued to these individuals that were involved in contracting this virus, maybe on a voluntary basis. It would be so beneficial to us to know if these residents had traveled, if they felt they contracted the virus here in our county. Maybe they spend their summers in Ogemaw County. We're not provided, like I say, the information that I think could be very helpful. We don't know if these individuals live near a swamp or a sewage lagoon. So that is something that I would like to pursue this year, to see if we can't come up with something that can provide us more information. Whether it goes up anywhere is yet to be determined, but I think that would be really, really helpful to us.
So Larry, you don't know what part of the county they're from then?
No, unfortunately, that information remains all private, but I would like to, like I say, get with the other mosquito directors as well to see if we couldn't get just maybe some general information. Even a township would help.
Yeah.
It truly would. It would. So something yet to be determined. Testing results indicated that the Culex pipiens species were the main contributors of the West Nile virus detected in the county. If I could turn your attention to page 23, according to December 5th, 2025, the statewide weekly summary from the Michigan Department of Health and Human Services, their arbovirus activity results indicated 207 mosquito pools were tested statewide for arbovirus infections. 96 animals tested positive for the West Nile virus infection, and there were 60 human cases of the West Nile virus statewide. Across from that page, on page 24, that is basically the same information that Michigan Department of Health and Human Services provide us as far as a yearly informational sheet. But that particular chart is something that our biologist has created. It's a little more easier to read as far as human cases and what counties have reported disease as far as the West Nile virus or any other arbivore viruses. We're going to continue this chart as we proceed into the future. And this is something that will be available as well on our county website. As far as our trapping information and results, our grab traps generally capture Culex pipiens and Culex resans, which can transmit the West Nile virus as well. This season, counts were steady with an average of 850 captured per month in June, July, and August. A notable decrease began in September with only 35 captured. Our CDC light traps are used generally to test nuisance level mosquitoes and check the effectiveness of barrier treatments on our residential properties. The highest level of captured mosquitoes was Culex pipiens and Aedes canadensis. The total of CDC trap mosquitoes captured for the season was 233. Our New Jersey trap light traps are placed in a fixed location throughout the county, and we have a lot of these throughout the county. These traps supply historical data on mosquito populations. Our 2025 New Jersey trap light totals were 17,238 compared to 19,623 in 2024. We added 147,715 miles to our truck fleet in 2025. 9 townships participated in our tire recycling program in 2025. And again, I can't thank Mike Miller and Beth at Recycling for helping us and doing the majority of that work for us. We really appreciate that. We communicate and maintain membership with the Michigan Mosquito Control Association, as well as the American Mosquito Control Association. Looking ahead to our 2026 program plans, all of our required permitting has been completed. We attended the Michigan Mosquito Control Conference Association conference this year in February. We attended the Technical Advisory Committee meeting for approval of our annual report in March. We did implement phase 2 of our Frontier Precision GIS tablet software this year. So this will be the first full season that everybody will have a tablet out there, and we're really looking forward to see the results of that. We did purchase 2 new trucks. We have received one of those trucks. The other one had to be placed on order. We are hopefully expecting that within the next couple months. We did purchase 2 new ULV foggers as well for our trucks. Obviously, we all know we have our 6-year millage renewal coming up in August, and we plan to increase our citizen outreach and communication through a new social media outlet. I'd like to quickly say thank you to our office staff for helping with this report and putting so much effort into it. I couldn't do it without them. That's basically it for the report, unless you have any questions for me.
Sure. Barry, do you send this report out to the township supervisors?
I do not, but that is something I could do, definitely.
That would be, I'm looking here at Elkland Township, you've got, there's
Yes,
that kind of a
there's
big spike there, so I'm just kind of wondering.
yes, we have extra copies. I could send a hard copy as well as a digital copy.
Yeah, that might be.
I appreciate that suggestion. That's a great idea.
Larry, if you wanted, I'd be happy to assist you and I'd get it to the clerks. I have all of their emails.
Oh, perfect.
And so if you want to email it to me with any notes that you'd like to address, I'd be glad and
Okay,
ask them to forward it to their board members. That'd be
great. I appreciate that.
You're welcome.
Any other questions for Larry?
Just one last thing I'd like to address the board about. Our field crews have been out there in the field this year. Obviously, we've started our larvicide portion of our program. They are noticing a lot of tick activity. We've had several residents call asking about tick information as well. We have been noting and logging particular areas where we're finding heavy amounts of tick activity. So we are keeping a general record of it. Yesterday, I did post this posting to our county website, and it just gives some general information about tick bite prevention, as well as removal, treatments, and several recommendations there. So I just wanted to throw that out there, that it looks like it's going to be a very busy year for ticks. So just a little something I wanted to add there.
Okay, any more questions for, Larry? Larry, you're doing a fine job with
Look,
it.
Charlie, just one.
Appreciate that.
I do, Larry, on the tick upbeat, what do you think the causality is? Is it moisture? Is it, what is driving it?
You know, this was a big discussion at our MMCA conference this year in February, and it is almost every year now. From what the information that I've gathered from some of the experts in the field, it does relate a lot to weather, as far as dampness, temperatures. You may recall in the past we haven't had a lot of tick activity years prior, but changes to our climate, we seem to be having summers that are wetter. We're having falls that seem to stay warmer longer. We're seeing days in November that are, still reaching 80 degrees. But weather seems to be the predominant issue as far as I don't know if they migrate, or I'm definitely not a tick expert, but I do feel that from what I'm hearing, weather does have a big portion to play in the tick activity.
Well, we have that definitely, but what's the life cycle of a tick then? What is is it a full season, summer
Yeah,
months, or do they have a?
I guess I really don't know the particular life cycle, but I do know they're climbers. One thing that was brought up in our conference, they like to climb into high areas. So anytime you can avoid pushing yourself through vegetation or keeping your pets out of those areas always helps. They'll attach right to you quickly, but they like to climb, and we have several videos of them actually reaching out, trying to grab a hold of something to get a hold of. But I apologize, I don't have a lot of tick knowledge yet, but I'm definitely learning more as we go along here.
I'm asking these questions because if you're familiar with any of your family members that had a tick bite, and I'm not a medical professional, but doxycycline is what's usually prescribed for infection. It's a nauseating drug.
It is.
And so they usually take it a week or so, and having some familiarity with that, that's why I was wondering. I was hoping you'd say they last about 3 weeks and
I
they're
wish I
gone.
could say that.
But yes, definitely there's been an uptick in the number of ticks that people are engaging in. And in my discussions, they're in areas that typically wouldn't have a tick. I mean, this is new. It's not tall grass. I guess could be anywhere.
Yeah.
It could survive, and animals as well, into the homes, into the beds, into the kids, and there's a new focus for you.
There you go. There you go.
Tick control.
Our truck fogging product does have permethrin in it, which will help control some of the ticks, and it will kill some of the ticks. However, we aren't technically regulated to treat for ticks yet. That's something the Michigan Department of Agriculture has been looking into. As far as I know, that's continuing there, but we haven't received any updated information as far as regulations or anything like that that we would need to follow to particularly treat for ticks. So more to come in the future for that, I'm sure.
With you guys talking about the ticks at your annual conference, it sounds like there's a larger interest. What can we do to help address the issue of treatment of ticks? Because I'm seeing all over that it's becoming quite a
Popular.
problem.
Yes, I would definitely say or recommend reaching out more to the Michigan Department of Health and Human Services. They're quite involved in this already, but they're a great source. We're also keeping involvement with all of the mosquito control companies as well as the other districts. The other districts, Saginaw Bay and Midland, they're very concerned about this as well. I don't know if our program would, as far as I know, consist of a future of just particularly treating for ticks and mosquitoes, but there has been talk of that. I know that, but that's probably our best resources is Michigan Department of Health and Human Services. Maybe a little push there to help couldn't hurt at all, for sure.
Our legislators as well.
As well, absolutely.
Larry, we appreciate it.
All right, thank you,
Larry.
commissioners.
Thank
I
you.
appreciate it.
You have a good day, man.
You too.
Mr. Chair, I move to approve and place on file 2025 mosquito abatement annual report as presented.
I'll support that.
It's been supported by Commissioner Cook. It's been motioned by Commissioner Lutz, supported by Commissioner Cook, to move to approve and place on file 2025 mosquito abatement annual report. Any more discussion? Hearing none, all in favor say aye.
Aye.
Motion has been approved. We'll move on down to new business and, Terry, you're up next.
No,
We missed number 5.
number 4 and 5.
We added Carrie to number 4.
Yeah, and carry to number 4. 4 has already been taken care of as number 1.
They got up. I didn't think they were confused.
Good morning,
What?
morning commissioners. I'm here to request approval of hiring Tricia Rollison, pending successful background check, drug screen and physical, on or around May 14th.
Mr. Chair, I move to approve per the recommendation of Terry Tabor, interim dispatch co-director, to hire Tricia Rollison. Okay. To fill a vacant full-time dispatcher position at step 1 at the rate of $19.52 an hour with a start date on or around May 14, 2026, pending a favorable physical, drug screen, and background check.
I'll support.
It's been moved by Commissioner Cook, supported by Commissioner Barros, to move to approve for the recommendation of Carrie Tabor, interim dispatch co-director, to hire Teresa Rowson to fill the vacant full-time dispatcher position at step 1, at the rate of $19.52 an hour, with a start date on around May 14th, 2026, pending a favorable physical, drug screen, and background check. Any more discussion on that motion? Hearing none, all in favor say aye.
Aye.
Motion has been approved.
Thank you.
Thank you.
Thank you.
Move on down to number 5, in the business general fund finance projection updates with Acumen and County Council.
Good morning.
Morning.
Good morning.
Okay, so we finally have some projections that we've been asking for. Apologies that it was not included in the agenda packet, but apparently legal documents cause issues in the scanning procedure. In order for you guys to get a recap of what was happening, what's projected to happen, we needed it on a legal document. I feel like it's easier to see. So to start off, there are some charts at the front. The very first page, I believe, are the revenues and expenditures. The green line is the revenues as they have been historically. Those are true numbers of how we've ended the years previously, and then how it's projected through 2031. The red line would be the expenditures. And then at the very bottom, you can see the fund balance, which will show you the revenues over the expenditures and what the fund balance would be doing each year with these projections. The second graph that you see is just a closer view of that fund balance. So should be very close to what that blue line looks like. And the previous graph is just closer up, so you can see a little bit more detail in that graph. But to kind of give you an idea of where these numbers come from, since you haven't had time to probably go through it yourself, based on timing. Historically, the final numbers are true to how we finished those years. So you can see 23 through 25 would be our historical numbers, with the exception of 25, because that journal entry that we talked to you guys about that will occur during audit when you're talking about the wage increase and all of that, that still hasn't happened. So the final number for 25 is still not reflecting that 300,000 roughly. It's not exact 300,000. There will be more left in there of the fund balance once the audit is complete. So just keep that in mind. So 2026, where did these numbers come from? Because now we're going to move forward. We're going to quit looking. We'll kind of talk about the past, but we're going to try and look forward. So 26 numbers, where the projections began was the system brings in our amended budget, was what I selected to work from. That is the budget that this board has approved for the 26 year. Once I did that, I went line by line to look at, are we tracking appropriately? Are these lines doing what we hoped the budget would be doing? That is tricky to do in that revenue lines were only complete with the first quarter. And if you ask me today, what do we have for revenue? It is not what we are projecting, because taxes for 2026 have not even been billed yet. So we won't even see any of that revenue until after July 1st. So if you ask for a 2-day picture, it will be different than what we're projecting. But I truly believe that this is as accurate as we can get at this point.
To that, what we would be seeing to that, we would be seeing more expenses out than actual revenues come in.
No, you're good. So after looking at each of those lines for 26 and adjusting accordingly, so if departments or in the budget we said certain revenue we're expecting 100,000, but when I looked at it tracking, how are we first quarter this year compared to first quarter previous years, and then what can be expected, I adjusted 26 to reflect what I am seeing for 26 and what I am projecting 26 to be. After that was complete, 27 through 2031, the projections I did was a 5% expense increase each year. So every year the expenses went up by 5%. And for I did a rotating 2% increase to the revenue. So for 27, there was a 3% increase to the revenue. For 28, it was only 2%. For 29, it was 3%. For 2030, it was 2%. And then 2031, another 3%. I feel like that gives us a little bit of a more smoothing effect of, we don't truly know what the revenue will increase by, but I don't want to overstate it. So by stating our revenues are going to increase by more than our expenses each year, I'm hoping to build in a buffer so that we don't see what we are seeing on that graph between 21 and 25, where you see the heartbeat effect on your graph. It should be looking more like 25 through 2031. When I was adjusting 26 figures, something substantial that stood out that I think is worth noting, but also keeping in your mind, is that healthcare savings in the first quarter were substantial. What we budgeted for our healthcare costs, I was able to reduce by 50%. However, what's concerning about that, so your 26 numbers for healthcare expenses projections are reflecting that 50% reduction. What I'm concerned about is that we have a new healthcare administration that we're using, and we don't have the history to look back to see, okay, first quarter, this is how we're tracking, but first quarter last year, how are we tracking? It is very different because we have the new Sharks program, which is our prescription coverage. And so while it looks great right now, I want you to keep in mind that it could change. Once we can only make projections on the information we have at the time. A year from now, we should be able to see the trends and we should be able to create better projections with those trends. But given what we have right now, I did adjust the 26 numbers to reflect that change because that is what I'm seeing. I believe we should monitor those lines very closely and update it as frequently as we can, which would be quarterly. Something else that is added for 27 through 2031 as an expense, the budget this year, we removed capital improvements. There was no transfer to capital improvements, which was concerning. To build that back in, I did add $100,000 as a transfer to capital improvements for 2027 through 2031. Not that that means we have to do it, but I just would like to see that expense be brought back into our budget as we need capital improvements.
And also to that, adding to that is that Mike and I discussed that we're going to be forced to go to the SNA cloud, and that's very costly, as Ian expressed. It's going to be costly, so we do need that buffer in improvements. We're definitely going to need that.
That's a different line though. Capital improvements and there's a different capital improvement for our.
There's two.
244.
Yeah, 244.
Equipment.
So that one's
Equipment
different than this
technology.
line.
But this would need to be addressed is because we are going to need to go to the cloud. And that's going to be forced.
The other things that I did, I reduced 2026 transfer outs. So they're in these projections. So in our budget that we approved, when I reduced the healthcare expenses for each department that's hitting that expense, I looked at departments that are receiving transfer outs from the general fund that are also using our health insurance. So if our health insurance across the board is being reduced by 50%, I looked at those departments' healthcare insurance and reduced those by 50%. And whatever amount that was, I reduced the transfer out from the general fund. Because in my mind, if that health insurance cost isn't there as an expense, they wouldn't need that additional revenue to be comfortable. So keep that in mind that is also a change that is here. For 2027 through 2031 with those reductions, their transfer out is still increasing by the 5% as all the other expenses are as well. The other thing that I looked into is the reduction for the animal control fund of the 239 transfer out. Because I looked at history and historically what those transfers were. And something noted was when the truck was purchased, there was a grant mishap where the general fund had to allocate more money to that fund to substantiate not receiving that grant. As a result, an additional $80,000 was given to the animal control. And the next year was also budgeted with that same amount included, the $80,000. So
That was already done.
for multiple years,
Yeah.
animal control has been receiving an additional $80,000 of a transfer out from the general fund to account for the truck that they only purchased once. So that is also included. Not that any of these decisions are final decisions, it was just projections of what I'm seeing, what could happen to help the general fund. So going forward with that information, I provided, I don't know if you want to give these to everybody. This one's mine. because this is the first you're seeing these projections, and I can only show 9 years on a legal size document. And I want to give you the history. So the sheet she's handing you right now is showing 2018 through 2026. And the sheet you already had 2023 through 2031. I only gave you the last page to show you, like, it's not your entire packet. I can provide all of that to you if you want it, to see line by line. But I thought you'd be more interested in seeing the very last little bit of information at the bottom of the page. That's the revenues, expenditures, and what the fund balance has been trending. My advice is to operate within your budgeted amounts. Ideally, this projection is what we're going to use to move forward with our budgeting efforts for 27. And as I said, this hopefully will be updated quarterly for you based on decisions you're making that are affecting the general fund. And we can use this as a mechanism to figure out how do we move forward in a positive manner for Tuscola County. Because what I'm seeing is that the 1.9 deficit that was previously projected is not gonna happen if we continue doing what we're doing. If we keep spending, I don't wanna say that the 1.9 million projection was inaccurate, because as I previously stated at the beginning of this, the projections are only as good as the information we have and what we're seeing. So I don't know, because I didn't do the previous projection, but when you're looking at that and you're seeing these spending habits and the revenues not coming in, you are going to project a deficit because something has to change. I'm happy that I do feel like in 25, we made a change. Department heads came together and we made a change. And you can see it reflecting, you'll see the end effects of 24 and then also in 25, right? So, to keep moving forward, what I would also suggest in our budgeting efforts was that certain departments did make cuts, substantial cuts. I mentioned the one about capital improvements of the 100,000 not being budgeted for 26. We need to come together as a county and prepare for our future of what are we seeing for these revenues and what expenses are we going to have to plan for. And while every department can say my expense matters this year, we need to collectively figure out what can we plan for. Like, yes, it is an expense that we have to do. However, can we budget for it to maybe put 20,000 for the next 5 years aside to allow for that expense to happen and the smoothing effect to continue versus the spikes that we see on these graphs. So I would like to see a 5-year plan of what we are needing. What does this county need for the infrastructure, for certain equipment, whatever that may be. Ideally, what I would like to also see is that this board receives a 5-year projection quarterly, because you're making financial decisions without any sort of information other than what's budgeted and what's not. As I said, the decisions you make will change these projections. So as the decisions are made quarterly, we'll show you what your decisions are doing and what they're trending and tracking. And that way you have the most up-to-date information that you can in order to operate effectively. The other note is, at the end of all of this, so back to the packet you guys had, not the extra sheet that was handed out. The very last page is showing the revenues less the expenditures and what was projected to be put into the fund balance. While it's exciting to look at 26 and say, great, we're gonna have $288,000 left over at the end of the year. This is a projection.
Yes, and then might not be true, you know. it
And
depends.
what I'm concerned about is that does sound great and I like seeing a positive number. However, keep in mind that 288,000 is only 1.8% of your total revenue you're bringing in for the year. That is not much room for error. The other thing that I would like to point out is that when I spoke of reducing those transfer outs and what that does to those projections, if we didn't go through with that, which is okay, my recommendation was to reduce it, obviously, in my projection. But if we didn't, the difference of what was adjusted was $193,000. So if we keep it status quo with what is transferred, the forecast for 2026 going forward would need to be reduced by $193,000 every year in your remaining revenues less expenditures. So for 2026, it has $288,954 with the adjustments I'm suggesting. If we don't do those, you're looking at $95,954 left over in remaining revenue as your margin of error in this projection. So I guess my advice is that every financial decision you make matters. And going forward, I like the trend I'm seeing. I can look at the fund balance as a percent of the budget, the very last line on your sheet, and I can see that we're staying consistent, okay? But it's projections. If we look at history, which is that sheet I gave you to tie back in, where you're seeing 28 through 2026, you can see where we're jumping from 21%, 23, in 22 we go to 60. We're not, it's all over the place. Keep in mind that that is also reflecting COVID, when we received losses to the county revenue from COVID, what we experienced. Then when we received COVID money, this spending of it. So it's reflecting those expenditures. We received the money the year prior, but then the next year we spent it. So while the history and showing you this is important, keep in mind that there were big events that happened that resulted as a result of showing you this.
Leading up to the spikes, yes.
So I think I covered everything that I wanted to say. I don't know if you guys have any questions. Also for 26, I do want to point out the budgeted amounts for the wage increases that you approved for non-union employees were not in those amended numbers either yet. And I did update those. So 2026, the revenue or the wages, the fringe benefits, all of that have been increased as well by the 2.5% that you guys approved. So that is reflected in your 2026 numbers.
Wow. Yeah, myself, I appreciate all the work you went into that. We all understand it's projections, money coming in, money going out. What we do today, tomorrow, next week, you can change everything. We understand that, but I really appreciate that. Any questions for these ladies right here?
I appreciate the fact that she's suggesting that we do this quarterly observation and planning. Like at BSNA, I don't know 5 years ago if people would have known that they have to move to BSNA software 5 years ago, but putting in a contingency estimate for some of these things that you don't know. But yeah, some of the big projects you can plan for in that 5 year. And that's a great idea. I don't know if it's been done before, but.
And like you always get, I mean, down the road, what parking lots has got to be paved, what's Russell's got to be done, you know what I'm saying? And that's all part of that too. It was projects down the road, we can do this in 3 years, 4 years, 5 years, but if we have that list together, which is a good idea, you can say, okay, we're gonna do this, we're put this away, we put this away, because some of them all gotta be addressed, so time. This was,
Can you give me those numbers that you used for revenues those years? I just want to make sure I got them right. Did you do 3%?
I did a rotating 3 and 2.
3, so 3 and 27, 2 and 28, 3 and 29, 2 and 30, and 3.
Correct.
Okay, I just want to make sure I had it.
Yeah, no. you're
Thank you.
Mhm.
Thank you.
And so, just so, this projection is a feature built into BSNA. It doesn't, I don't want to tell you it doesn't take time. It does take time, right? But realistically, it took a day. Now that these numbers are in there, it's easier to just
I take back what I just said.
yeah, it's easier to maneuver with what decisions we make. Now, keep in mind, this is just general fund. We can essentially do this with every fund.
Yeah.
Every fund can have this. But our focus is the general fund. And so these projections, it's not necessarily difficult to provide these to the board. And it is something that I actually did back when Neil was here. This was created. It was never provided to the board. So it's been done. I was able to look back at my work that I did when Neil was here. And it was exactly very close for 25. I projected exactly where we're gonna land back when Neil was here in 24, 20, whatever. Maybe it's a fluke. I hope not. I hope that what we're on is a track of we're gonna do good, right? And we're moving in the right direction. So I encourage requesting this. I encourage it being shown and shared and updated, so that way it makes your lives easier, and hopefully her life easier and my life easier. And if anybody has any questions, I know that it was a lot to kind of look through. I'm here. You can come see me. You can come see Connie. I do note in the projection, I don't know if you guys have BSNA access, you can see there's a notes section, Connie actually printed them, where I typed how I figured what I figured. So that way, hopefully, later on down the road, if you ask me, well, why did this projection, why was it so far off? And I can say, well, I projected this, but this is what actually happened. So hopefully we can paint a better picture for Tuscola County.
And with knowing this, because I didn't know anything existed in BSNA with this, it would be a lot of help with the control job to project more out further. Instead of using spreadsheets. That's how it's been done.
Mr. Chair, I get a question. So if I look back on 18 through 26, and I look at the expenditures, it looks like, other than of course the COVID year and when we had, all that stuff, that, and I haven't used my calculator,
Yeah.
but it looks like 5% is pretty accurate, what it's done in the past. I guess the only thing that concerns me, and you touched on it, was not with the health insurance. Now it's looking great, but who knows?
It can change.
So, yeah, back to that, is there any way that company could give us,
A projection?
no, not projection, but past with other clients that they've had?
So what, I went and met with Shelley after I got these numbers corrected, got these numbers entered and said, what am I missing? What are your thoughts about me making the statement and correction to the healthcare? Her response to me was that she was comfortable with me stating I could reduce it by 50%. However, we need to make the statement like, this isn't for sure, right? That we need to tread cautiously because we are self-funded and we could ask what did other counties do, but unfortunately, because we're self-funded, then it's specific to our county. What do we do? What is our costs, right? And then also the other issue that she saw potentially was that the stop loss, I don't quote me, I want to say it was in the 35,000, I think, and now it's 100,000. So for each body insured for Tuscola County, the county is responsible for that first 100,000. So potentially we could see next quarter where it's right back up to where we budgeted and maybe we need to actually add to the budget. It all depends on the treatment the county employees and families insured are receiving.
And that's the correction.
Yeah, and so it's hard, it's difficult to project. I mean, typically, once we have the historical,
Right.
you can see trends in like, if somebody gets a heart medication every month or something, that you can plan for that. You can't plan for the incidentals that happen, but for the majority, you could plan.
That's my own, I mean, let's face it, that's the biggest expense.
And it was huge saving. Like, so when I first entered these numbers, with the rotating 2% and 3% and then the 5% increase for the expenses, I want to say we were like negative 500,000. And I was like, oh no, this isn't going to be good. And then I started going line by line just to see where are we tracking. And when I got to the first health insurance item, I was surprised. It was great news, but once again, what are we going to see next quarter?
Thank you.
Chairman, I have a few questions.
Well, and also Blue Cross Blue Shield had all those stop losses and stop loss, all the admin fees, everything within the bill itself.
Right.
Now we're not seeing that anymore. We're seeing all different kinds,
Yeah,
from
we
here.
gather up from other places.
Yes.
Well, thank you, Ashley. It's been over a year. And to know that you've done this for Neil is certainly eye-opening for me in the sense that I think we had that discussion some time ago, but the mere fact that it's April and the 26th, this is a blessing for this board in terms of financial projection. I think you've done an excellent job. In terms of the graphs, the expense revenue graph, we've asked a long time for another graph, and you certainly came through with that. And looking at the general fund graph, the fund balance graph as well. And I certainly appreciate the second graph, which is sort of a microscopic, how far is that distance from that line? That sort of gives you an idea. But the real meat in this is what you just went through. And I appreciate that. I can't tell you how much I appreciate it. I'm sure Commissioner Cook in terms of finances and projections, and the fact that the 1.9 was accolade for so long with such a mystery, and that you've made comments over the last few weeks and maybe before that. I know we've had discussions that, no, I don't think it's quite accurate, but that was the only thing we had at the time. And certainly from that perspective, this sort of will replace that. When you look at the reserves, and if it wasn't for the ARPA funds, which got transferred into the general fund, we would be in not good shape right now. That is our buffer. Is that
I
not
want
true?
to believe that that statement isn't true. It's kind of the old saying of, it doesn't matter how much money you make, you're still broke, because when you have money, you spend more, right?
Mhm.
So I want to believe that the spending, it was just kind of a windfall for the county. The additional building we put together maybe wouldn't have happened if we didn't have the ARPA money, right? So I want to believe that we were still trending okay. And I feel like the additional revenue we received as a result of COVID assisted the county in being able to get some projects done. I don't know.
Well, look at it this way. The 10 million, when we ended up with the 2.3 or whatever the number was, it's still sitting in separate, and it's in the general fund now. Take that out. That's a buffer that could be drawn on. I mean, that's unrestricted. Now, if you take that out, I have to process what you're saying in the sense that where would we be today wondering, where do we have to go to for additional funds? Well, we have that yet. Fortunately, I think as you've been saying in terms of budgeting, we've been able to not spend that just by the revenue that we're receiving and the expense reductions, and that's what you're showing here. And I appreciate the past history. That is very important to look at, and you see those general fund percentages.
And the other thing about that
Over.
past history that I do want to get you the full packet for the past history so you can see line by line. Because the other thing that was projected that came in for the amended budget was the use of fund balance. And with these projections, so that was built in of use of fund balance, and back in your history of 18 through 25, 24, we did not use fund balance. But I don't know if it's been removed,
Yeah.
but
18 to 26.
yeah, so we don't have to use the projections I did for 26 through 2031 do not have a use of fund balance. This is just revenues and expenditures. I removed the use of fund balance, which is a good thing.
But we also have to balance. That's how we balanced, because when we budgeted, the revenues were short.
Correct.
They were short. So that's why we had to use this fund balance, because the revenues were short for budget for 26.
So I can see you're confused on it a little bit, maybe.
No, I've got a question. Talking about this money that we received, this large amount of money that we're now using and it's in the fund balance now. Is that able to be just broken out separately? It's put back into the system. It's put back into all the line items as it's expended, that 10 million. And into for uses, for different things that it's been budgeted for or used for. It goes back into the different line items, correct? No. Is it separated out there?
Yeah,
So,
the
and it's
10
always
million,
stayed out, so
the
it can
10
be backed
million.
out?
The year, where did we receive it, that you can see? It goes into the fund balance, and then it's been restricted, so you'll see it on your balance sheet, and it'll say unassigned or assigned fund balance, and it's accounted for in there. It's
Okay,
not
then it goes
appearing in
back
your
into-
revenues for each year.
Whatever it's used for, it's backed into that particular program.
It's
as
all,
it's-
it's all
as
dumped in a pool.
Kind of think of it as like a savings account. It is the general fund savings account, right there on your balance sheet.
Okay.
But there's
I was
not
just-
currently 10 million in there.
No.
Right.
We've spent most of it. I think there's around a little over 2 million.
Yeah.
2.3.
But is that separated out so we know how much that is particularly? It's not.
It's just dumped in
It's
a
just
pool.
dumped into the pool.
Chairman,
It would be nice if that.
Commissioner Burrow, have you seen somebody used to provide us with it's not ARPA anymore, ARPA tracker, and it showed where that money was spent.
It's the
Could you get,
PPS.
you probably haven't seen that.
I don't think I have, no.
We can
You still
provide
have
sir.
that, I think, don't you?
I'm sure we've got it, yeah.
I think Clayette had that.
Yeah.
Yeah.
That was pretty good sheet to
I think
show.
she started that, I think.
It
Pretty sure.
is, that tracker sheet is still on the county web homepage under top news.
Oh,
There you go.
good to know.
Under what?
Top news, so as soon as you go, it's right, it's just a handful down.
I want to get, I know we
Like 7 or
segued
8
out
down.
of the, where I was going with this, but I appreciate that because you definitely would have to see the makeup of the projects and how it was spent.
There you go.
And the fact that it was the leftover, we had a choice, we had to put it in our
Commissioner
general
Barrios?
fund.
Right back in.
Here.
Okay,
I'm sorry.
So
Thanks, Ian.
taking another step further, on the 26th, you indicated the 288,954 at 1.8%. That's a small buffer for a lot of unknowns. And if you look further, that gets further reduced as you go.
Yes.
So the message I think you're saying is, you said it probably in more gentle form than I would. You need to really look at your spending. And the curious part of this whole analysis, does this include the increasing shortfall within the MERS program? All right, this has not been discussed, I know of. That's a substantial amount of money, which would negate a lot of what we're looking at. And I would like to see a projection with some kind of moving forward, what would we expend in expense to bring that up to a situation where it's acceptable again? We have heard discussion about the road commission's pension. Well, our own pension needs to be reviewed. Well, it's not a pension, it's the retirement. So that was my concern and my fears in the presentation, is it was not included in this. And I think even though this is a very pertinent document, and maybe we weren't prepared for that, but we need to go back and see how we're going to address that, because that had slipped away. And from what I remember, it was pretty substantial. I also appreciate, on behalf of the board, discovering at $80,000, you just keep carrying it forward. That could have funded the EDC's request easily. And these are I don't know if there's any more like that. Once you appropriate, it just moves forward.
At fiscal year end, or actually at budget time, I discovered some line items that weren't being used.
And
that's,
yeah.
you started getting rid of them.
So, I mean, in terms of, I guess we're not there, but we could be there very quickly, depending on where this analysis is going to come from the retirement. But anyway, I just wanted to finalize with that in the sense that to certainly accolade everyone's thoughts that this needs to be a quarterly projection. And Ashley, I really appreciate the effort you put into this, and Connie, in terms of bringing this forward, because it was the first view we have, although it's a very delicate one with some major contingencies, that the board has to determine expenses. But in terms of the, Angie, we've had this long discussion. In terms of taxes, our main source of revenue, you had an increase in that going forward. It just seems at some point we're going to see a decrease, which, did you allow for that at all?
There is, in the 5 years, there is not a decrease in the taxes.
Okay.
Like I said, I went historically of what you see in the trends, and that's how I based it. But what's really nice with this, once now we've moved away from spreadsheets and we're in BSNI, okay, this is what we're doing. You can manipulate fairly quickly the percentage increases for all the revenues and all the expenses. So if the board, like, this is just what I decided I was gonna show you, right? But if you wanna see revenues only increase by 1% each year and expenses by 5%, and what does that look like? This is more of an opportunity for you to say, what would you like to see as our moving document? And the system allows you to look back a total of 9 years and look forward 10. So we can project 10 years in the system with a click of a button. And like, once you have your 26 values in there and you tell the system how you want it to calculate, it calculates all of them for you. You don't have to sit and manually calculate.
Ashley, you want me real quick? Just to add to that, I get the concern, but I just wanted to add in, right now, we gotta remember tax bases, you know, as far as property tax revenues, is mainly affected by inflation right now for us, barring any economic development. But in the negative, pretty much 2 factors that we would have to watch, which we did have one year, a reduction where we actually saw that inflation rate multiplier go like negative. Or right now, what we've got to remember is values have gone up so high for so long. So most of us, when we look at our tax bill, for instance, or our change notice, we see our assessed values up here, our tax bills down here. So even if we started to see values start to come down, it's going to take a while for most properties before that SCV or assessed value pulls that tax bill down. So that's something we would really be able to see that in advance.
Is that like a 5-year window, or are you talking further?
Like right now, you know, we study on a 2-year period.
Okay.
We're still seeing values go up. So it would, you know, we'd have quite a good warning if we started to see things come down. And then beyond that, we've got to wait until we get to that period of time where those values get closer, and then we worry about it pulling things down. So just to add to that, it was a good question, but you know, we keep status quo, that should be okay. Okay, thank you.
Thank you.
You're welcome.
No further questions, Chairman.
I got one more. Can we get this emailed to us?
I think Mike did this morning. Yesterday?
Well, I emailed it to the department
Oh,
heads, but I'll email it to you today.
And the software you use is what? I mean,
It's BSNA,
DSO.
which is what the county uses for all of our financials and assessing tax.
And we don't have access to that.
I didn't know if you did or not.
I don't believe they
No,
do.
okay.
No? No. Be that way.
You're welcome. But before we end, because my hope is quarterly, right? And we are in April, so we have prepared for May and June to happen. So in July, hopefully Connie and I will be back here with a new report for you with updated figures. But is there anything different you would like to see from what we explained happened in the projections to what you would like to see removed, added, whatever?
And again, once we go through this, look at this closely, we got time to get with
There you
you
go.
and say, hey, I looked at this, but show us, you know what I'm saying? once we study this a little bit more and see everything is there, then we get time to.
My only request with that is that you each individually don't ask for your own projections at a different standard, that you
Okay.
collectively decide on one.
I do have a, I
Okay,
do have one of those, now that Ashley's brought up. It seems like quarterly, an exception report of some type that would show the board, anyone who's over budget in terms of expense by department. So we could look at those and understand what's happening. Because that's beyond what you budgeted. But maybe there's shortfalls otherwise would offset
Are
it.
you talking just general fund or all the rest of the special funds?
departments, I think he's talking.
Just departments.
Departments from quarter.
I mean,
whatever.
anything would majorly hit, but in terms of how are we tracking, what expenses did we underestimate, or is there a reason that we're spending more?
Unfortunately, I do think that we have to include all of the funds, because in the event, and we experienced it this year in our audit, I believe, in the event that a fund is negative,
Yes.
it has expensed more than it has brought in revenue, the only place you can take revenue to make it neutral is the general fund. So I do believe monitoring those individual funds are very important and critical, especially if those funds are already receiving a transfer in from the general fund.
True.
I do like the graphs. The graphs, I like that.
Good, I'm glad you liked it. Good. Thank you for your time.
Thank you, Ashley.
Yeah,
Appreciate it.
absolutely. Have a great day.
Thank you, guys.
Thanks.
Okay, that takes us through the new business. Everybody ready to go into the old business? Everybody need to take a break or anything? Unless everybody good?
Good.
Yeah, good. Then we'll jump right into old business. The first item of old business is the resolution for the local health department to approve non-residential on-site wastewater systems. State law.
So Chair, I move to approve and place on file resolution 2026-08, affirming Tuscola County Health Department's authority to approve on-site non-residential wastewater systems. Roll call vote.
I'll support that.
So moved by Commissioner Cook, supported by Commissioner Luce, to move to approve and place on file the resolution 2026-08, affirming Tuscola County Health Department's authority to approve on-site non-residential wastewater systems. We'll do the roll call vote. Is there any more discussion on that? Hearing none. Roll call vote, please.
Thank you, Commissioner Barrios.
Yes.
Commissioner Barbell.
Yes.
Commissioner Lutz.
Yes.
Commissioner Cook.
Yes.
Commissioner Vaughn.
Yes,
Motion carries. Thank you.
thank you,
And Commissioner Vaughn, I do have that prepared, so I'll have you sign it after the meeting.
thank you.
Thank you.
Okay, number 2, Health Department lobby redesign.
Chair, I move to approve the request from Amanda Ertman, Health Officer, to remodel the lobby of the Health Department and with assistance from Mike Miller, Director of Building and Grounds. Funding is provided by an infrastructure grant. No county funds are required for this project. All budget amendments are authorized as necessary.
Support.
It's been moved by Commissioner Cook, supported by Commissioner Barrios, to move to approve the request from Amanda Erkman, Health Officer, to remodel the lobby of the Health Department with assistance from Mike Miller, Director of Building and Ground. Funding is provided by an infrastructure grant. No county funds are required for this project. All budget amendments are authorized as necessary. Any more discussion? Hearing none, all in favor say aye.
Aye.
Motion has been approved. Okay, going back down to number 3. Well, we're back down to the Economic Development Corporation, EDC request for authorization to apply to the Minister of the U.S. DOT Safe Street Road Grant.
Good morning,
Morning.
Commissioners.
Morning.
So you did ask me to reach out to the road commission. I was able to speak with Brent. I can't think of his last name right now. He did mention that they are also applying for it, but they did not want to apply together at this time. I don't believe that's a strategic way. This is not a typical construction grant, so it's more of a county-wide strategic plan for a safety assessment plan. And that's kind of why I brought it to you in the beginning. Now, they're a key player in this. I wouldn't say collaborating be out of the question. So I'll attend their meeting on May 7th, see if I can persuade them to move forward in applying together, or we can still move forward applying on behalf of the county, whatever you guys think is best. I guess I wasn't aware that they were applying, and I did check into other counties like Macomb. They applied countywide, as well as Wayne County and Jackson County. Those were some ones that I could compare to, larger, of course, but they do it countywide. Because there's key analysis throughout that involve pedestrians, bicycle safety gaps, school access and traffic patterns, corridors, high-risk corridors and intersections, crash data. So it's not just based on the road commission.
So you said the road commission is applying for the same grant here?
Yeah. But I wasn't aware of that. Maybe you were, they said that you had.
Yeah, that they usually say what they applied for, but I don't recall that they applied for this one.
So I can, again, go to their board meeting on May 7th and we can hold off and cut it close. I think May 26th is the deadline for the application, or we can apply how I propose, but I guess it's up to you.
What is the word on this? I mean, I know we talked about it. I think it's a good thing. And one thing she touched on, I know not everything that this company does is road commission availability, like sidewalks, this, that, other danger things that don't have nothing to do with the road commission, for sure.
Right.
I'm assuming that they're applying for the same exact grant as we are. I don't think two people need to apply for the same grant, because the people are still gonna cover all the stuff that they said they were gonna cover, but I mean, we talked about this the first time, and I think we all agree this is a good, maybe a good thing for us to invest in, but on the other hand, I don't know, we should wait and see what the road commission is gonna do for sure. I mean, I'm board pleasure, but
I think that if I might interject here, I know the Safe Streets and Roads, I think the Village of Cassidy did this for their walking crisscross for the students. I think they had some type of a grant in the past from this organization for that.
So this is going on a countywide. So we're gonna base our assessment off the whole county, and I feel that's the best way to go about it, because there are several intersections we want to look at on a county level, and then just, bring our county, have a.
Yeah, I know that Cass City has done this specifically for their particular area, so there is a need in the communities. I just went to a meeting and they were talking about sidewalks and not having sidewalks up in the Akron area, Guilford. So there's a number of issues around the county.
Yeah, and I did have, that I can send, but some projections on how it would look, like the cost share on county and city and townships, and then the road commissions, that 20% cost share, but I'd have to grab my other phone to email it to you real quick.
I think too, that's that we gotta take out, if we would approve something like this, our next step would be go to the townships, go to the other people and fund us all together. And I think we could get that done.
My only concern is that with the current situation with the road commission, that if we don't apply, we could lose the opportunity. But again, open to waiting till after May 7th and reapproaching the board if that's how you'd like to move forward. And I did this. Sorry.
I'm not sure if, Chairman, I'm not sure if the road commission applies for this, if they'll be focusing on all the same.
That was my concern as well, and it wouldn't be as strategic as well, because in some sense, it's a safety-wide audit. So in turn, that would make them.
They might be focusing on one particular area as opposed to many of these. I don't know.
Yeah.
It just doesn't benefit to do a duplication of efforts either.
Yeah.
Watch pot never boils, you know?
Didn't come through?
Not yet. Oh, probably wouldn't say it did, I just think. Good.
So it shows what the cost share could look like over the 3 fiscal years if we included the townships, villages, and cities, and then the road commission. I mean, the county could also share a portion of that, but I didn't include it.
So the majority of that is Tuscola County Road Commission contribution.
Yeah.
And if they're gonna do their own, they might not necessarily wanna contribute.
Yeah, and at this time, they weren't looking at applying together, but they did encourage me to come on May 7th, so I'll do what I can.
Chairman, the silence is just
It's killing me.
killing. I would suggest the board, if the board would agree, that Alicia goes back to the road commission related to their intentions and clarify that in wake of the presentation Ashley gave and the fact that it was an unbudgeted amount. I mean, there's many factors. It has nothing to do with the need, obviously, but in terms of finances, this is sort of a situation where we have a proposal coming up on the ballot. We have the road commission who's applying, and I think we should stand down until we find out what.
Agreed.
Yeah.
I think there's a way we can work together as well, so
Yeah.
hopefully we can.
And I respect that. Well, yesterday, after this was on the thing for Monday, I did get a couple calls. There were people that were here that, think this is a good idea and encouraged me. Says, we got people that will go to townships. We'll raise this money. Don't let this be a money issue. So there's people out there telling me, hey, you put this forward, we will raise the money.
Good.
It's not gonna be
And that's what I heard as well.
Yeah, so they said, but we have to have it forward before we can do that.
Yeah,
So I'm just gonna throw that out to the board. I mean, this is, on the couple calls I had, that was their thing, don't let this be that 30,000, because we got time to raise that. Because that's over the next 3 years, 30,000, 30,000, 30,000.
Yeah, Chairman, I don't want to fall back in this old adage, but we just heard this morning where we applied for a grant for the mosquito abatement and it fell through. You sort of have the hope for, but you end up paying, with your checkbook out. I'm with all the townships, I'm just not convinced yet. I mean, you've got 3 years, but the county will be paying, somebody will be paying that yearly. You've got 3 years, and I don't, I'm a little skeptical of what they're going to see benefiting them as they go further out of the Carroll Village city limits, so to speak. So I just exercise an air of caution on that, the hopeful part. I'd rather have more defined. Financially. But unfortunately, that's
Yeah, I'm good with
sort of where,
All right, thank you.
thank you.
Would you like this placed back on the next committee of the whole for May 11th? For an update if there is one from Alicia?
Sure.
Yeah, we'll have to put it back on there if that's.
Okay,
get
thank
towards
you.
the end of it. Okay, move on to number 4, jazz proposal from New Microphones. This was discussed on Monday, and
Chairman, I move to approve the Jazz proposal for the new microphones for the People's Building for an amount of $5,332.96 per the recommendation of Ian Lee, Chief Information Officer. Funds to come from line item 244-259-000-000. Also, all appropriate budget amendments are approved as necessary.
Support.
it's been moved by Commissioner Cook, supported by Commissioner Barrios, to move to approve the jazz proposal for new microphones for the People's Building with an amount of $5,332.96 per the recommendation of Ian Lee, Chief Information Officer. Funds to come from line item 244-259-000-000. Also, all appropriate budget amendments are approved as necessary. Any more discussion?
Yes, I do. Mike, I know it was said Monday. Do you, how much is in that 244 fund?
There is an attachment to the agenda. There's roughly $180,000 fund balance in 244 fund.
Okay, thank you.
Yeah, we're-
I do have questions. When
Yeah.
you say attachment to the agenda, I just want everyone to know that my agenda is electronic. I did not get anything other than very thin copies of the agenda. So just a note with that. So give me a moment here since there's a copy I did not bring in.
Commissioner Bardwell, if you click on that, right underneath that presentation, it comes up.
That's what I'm using.
Okay.
Yeah, I got the, give me a second. So my question related to this last time, Ian, was, of course, it's unbudgeted. There's no doubt it's needed because we've experienced it. And if we haven't had a court session in there, we have some major obstacles. You would definitely have some major obstacles. Maybe bullhorns at that time, I don't know. But the question was related to 240 fund. It was mentioned that there was money in there, and then it was asked, okay, if there's money in there, what projects are been appropriated to that fund, and what's the balance remaining? And that was going to be provided, which is right here.
Mm-hmm.
Unfortunately, it's my first look. So of all the, I'm not going to take, since I'd have to blow this up a bit, I'm not going to take the time here, but in terms of what you can provide, what is related to the projects against that fund balance? What's remaining?
I checked with Connie and she agreed with me that after the projects are funded, maybe they won't spend it all, maybe they'll, whatever, but based on what we have year to date, there's $185,000 in fund balance.
And is that on this projection? It's not on this.
Yes, it's right on the very bottom
I see it.
of the year to date.
So that's with the expense, and that's not, I don't know, what are the other projects? That's above and beyond all the other projects expenditures if they were fully expended?
Yes.
That's a healthy fund balance. And that 244 fund is typically used for what type?
It's called the equipment and technology. It's used mostly for Ian's equipment, and we do put.
That explains it all.
We did make some aggressive cuts and requests this year. That was why you're seeing such a healthy fund balance. We only did bare bones minimum this year.
But with that said, Ian, is that going to come back to plague the board with more expense later on, the things you cut? That's usually what happens when we as you know, you will come back and, well, if you would have done this when I first asked, it would have,
I try to mitigate those requests as much as possible, but, you know, I can only use my best estimate. I can't foresee the future.
so out of your best estimates, and you've got a lot of insight in this.
We did expend $44,000 worth of projects, so it's not like we didn't do anything.
Right. No, I didn't mean that. I mean, what would be something that's, you think about quite often that, boy, I hope this doesn't happen type, the top three things that you took off the list that you're thinking, maybe. Does that come to mind in terms of what we set aside versus what could?
Luckily, we've already addressed those worst case scenarios in other years' projects. We're just maintaining those with this request. As far as our disaster recovery, our backups, our worst case nightmare scenarios, we've already
Address,
addressed those needs. Now we're just maintaining.
and this has nothing to do with the cloud, with BSNA or,
No,
that's different,
unfortunately,
fortunately.
I have a lot to say about that at some point, but I better keep that.
Looking forward to it. All right, no further questions, Chair.
We did have motion on that already, didn't we?
It's,
Yeah.
the motion's on the floor right now.
Any more discussion? Hearing none, all in favor say aye.
Aye.
Motion is passed.
Thank you, Chairman.
Thank you. Okay, move on to number 5. MIDC new hire request for Philip Falks.
Mr. Chairman, I'll make a motion that we move per the recommendation of Jeffrey Stewart, the Indigent Defense Council Administrator, to approve Philip Folks to fill the open staff position. Mr. Folks brings 30 years of legal expertise in criminal defense, wages starting at $71,191 annually with a tentative start date on or around May 12th, pending a satisfactory background check, physical, and drug screen.
I'll support that.
So moved by Commissioner Bartle, supported by Commissioner Cook. Move to the per the recommendation of Jeffrey Stewart, Indigent Defense Council Administration, to approve Philip Falks to fill the open staff attorney position. Mr. Falks brings 30 years of legal experience in criminal defense, wages starting at $71,191 annually, with a tentative start date on around May 12th, 2026, pending a satisfied background check, physical, and drug screen. Any more discussion? Hearing none, all in favor say aye.
Aye.
Motion has been approved. Move on to number 6. Committee recommendation for medical examiner services by Miller.
So in your agenda packet, I did provide you a brief summary of the RFPs. Committee did meet, went over these. It is our recommendation that Michigan Forensics with Dr. Spitz, they are the low bidder. And his references that we've checked with are glowing. I didn't receive any bad comments. I don't believe the sheriff received anything bad. It was all positive. And based on that and being the low bidder, we believe that would be the best recommendation to the board.
Mr. Chair, I move to approve the Michigan Forensics PLLC proposal, who was the low bidder for the medical examiner services, also to approve the interim administrator to work with legal counsel and Michigan Forensics to develop a 1-year contract for the board to review and approve, with the intent that Michigan Forensics to begin to provide medical examiner services effective on July 1, 2026.
I'll support that.
So moved by Commissioner Lutz, supported by Commissioner Cook, to move to approve the Michigan Forensics PLLC proposal, who was the low bidder for medical examiner services. Also to approve the interim administrator to work with the legal counsel and Michigan Forensics to develop a 1-year contract for the board's review and approval, with the intent that Michigan Forensics to begin provide medical examiner service effective on July 1st, 2026. That is in motion. Any more discussion?
I do have some questions, Sheriff.
Yes.
I'm just reviewing this. In terms of Michigan forensics, is there anyone else in the thumb that are using them other than St. Clair? Which is really not the thumb, but
Well,
maybe.
yeah, St. Clair uses them, Saginaw County does, and then Huron County uses them as some type of a consultant.
Where's he based out of?
Well, he seems to be a little bit all over, but his address is Grosse Pointe Farms.
Where would he do the autopsies?
Based on what the sheriff learned, it would be in Port Huron.
And related to the MESI and compared to the other bids, what was the total amount of savings that is the lowest bidder? What are we talking about?
Well, if you look at, so like for Dr. Maroney, his bid to do, if it includes the autopsy, it's going to be $2,940 per case. We're Michigan Forensics, the autopsy, which includes transportation, is $2,400.
And that's based on what you did, the number of autopsies on the average, that's how you use to.
We didn't use it, that's what their bids were
Just
per
a
autopsy.
number. But you don't really know how many autopsies we do a year related to Tuscola County?
The last report that we received, Mark Ransford provided some numbers, but Dr. Maroney in his bid included his 2024 annual report. And I want to say there were 33 autopsies done in 24.
So it's
I don't have numbers for 25.
using that, it'd still be less expensive to use Dr. Spitz?
Yes, based on their bids.
And this covers, it's saying transport, this covers negates the issue that the Ransfords were faced with.
Yes.
Spitz does.
Yeah.
Well, and so does with the new RFP, even all of them had to cover all the transportation, so there was no, the Mark Ransford issue was alleviated.
Okay.
And with the M&E service, medical examiner service, it's is the lowest bid by how much? If you added up projected, how much would we save by using Dr. Spitz?
I honestly didn't put all of that together.
Okay.
Maroney is cheaper on the ME services, just to be the ME by the $37.50. But I think where you're going to get the savings is going to be on the autopsies. And the other thing to remember that we talked about too, when we talked with, or at least I did with the references that Dr. Spitz had, all of them said that he was very timely with his documents.
More timely than we're getting.
We've had issues in the past of, death certificates and such being issued on a timely basis. And any of the people that I spoke to didn't have any of the issues with Dr. Spitz.
And remind me, how long was the contract for?
It's going to be a 1 year.
1 year. And do they, I'm not sure the technical term, but it's not the ME, but it's the officers that go out.
The scene investigators.
Yeah, scene investigators. It covers the same scene investigators we're using, or is this?
Well, he could potentially hire different ones.
He-
It's gonna be the same setup as the scene investigator will respond to the scene to investigate, and then he'll make the decision, autopsy or no autopsy.
All right, that's his responsibility. Right, that's ME's responsibility.
Yeah.
I just remember we had officers responding, some were, maybe they still do?
We respond to every single one of them still, but we just don't do the investigation.
The investigation.
Years
Okay.
ago, we were the ones doing the evaluation.
That's right, I remember. Back in the Tom Kern days. and-
Yes.
Yeah, beyond. All right, no further questions.
Did you have anything else, Ron, you wanted to add?
Well, I was just gonna also point out that Dr. Spitz, there was a concern about retaining specimens and toxicology, and Dr. Spitz, when I was doing some follow-up, looks like they're retaining things for 5 years, whereas Maroney's timetable is much, much shorter than that. So in order to avoid any legal issues, the longer timeline would be much more beneficial to the prosecutor's office as well, by going with Dr. Spitz. So,
Okay, any more discussion? All in favor, say aye.
Aye.
Motion has been approved.
Thank you, Commissioners.
Yeah, that takes us to the old business. The correspondence was Kansas City Master Plan Update Review and the Chamber of Commerce letter to Deputy Nordstrom.
Yeah, Cass City has their master plan update. It's currently under public review, June 29th, I believe at 6 PM. They're having a meeting. If you want to attend if you have any comments on their master plan. And then number two, the Cairo Chamber of Commerce did issue a letter to Deputy Nordstrom and the worksite crew, thanking them for their help.
Commissioner Liaison Reports. Commissioner Cook.
Nothing to answer.
Commissioner Barrios.
Commissioner Lutz?
Oh, wait, I slipped the page, baby.
You wanted to forget me, didn't
That's okay.
I'm glad. Jody, can you once let me forget him? Commissioner Luke?
I just want to tell everybody on Wednesday, May 6th, me and Commissioner Cook will be at the cemetery as we've done in the past for the fallen police officers. It's if you've never been to it, it's really nice to watch that, and I think Commissioner Cook will be giving the prayer this year for the local people. That's all I have, sir.
Okay, thank you. Commissioner Barrios?
Yeah. Health and Human Services, I attended their meeting. There was acknowledgement of honorable mention award recipients from Tuscola County, which included Karen Southgate, our former director, and Nicholas Moorhead. And as she mentioned, 27% of Tuscola County population receives assistance. I think that's something that as a county, we need to keep in the back of our minds going forward as well. Karen Southgate's last day is May 8th. She has a reception scheduled for May 5th from 2 to 4 at her office. Tuscola County Medical Care Facility was recently recognized as a 5-star facility, which is a very prestigious accomplishment. It's not on their website yet. They have to go through a transition of getting that all on through all the different organizations. They submitted a grant for Senator Slotkin's office, Senator Peters' office, and Representative McLean's office. They were notified that they were not selected for Representative McLean's grant this year, but were encouraged to reapply. One of the questions that came up was from Senator Peters' office, where they submitted some questions to us, thinking that we should apply on behalf of them. And they've since reconsidered that and are leaving the Tuscola County Medical Care Facility to apply individually. I attended the Great Start meeting. Health Department talked about immunizations and the need to stay current and discussed a recent chickenpox outbreak at Highland Pines School. So our meeting wasn't as long as it normally was because they had to, they shut school down that day because of the chickenpox. 64 families are scheduled to attend the 3rd anniversary of the Family Enrichment Center coming up in June. Road Commission, I do want to mention a couple things that I promised the chairwoman that I would address. Brent Dankert took some negative comments based on his working with the Homage Bridge project, and Brent is actually not involved in the Homage Bridge project other than he was called upon by the Department of Natural Resources to provide them some information on a study. So he's gotten some bad press there, and he doesn't have anything to do with the Homage Bridge project. That's operating kind of slow, and it's nothing that's has anything to do with Brent. And the other thing is that there was a comment about the Road Commission receiving benefits, and the road commissioners do not receive any benefits. That was clarified for me to make sure I shared that with you. I do want to share with, as far as statewide, 36 counties have elected road commission boards. 43 counties have appointed boards, and 5 larger counties, Macomb, the larger municipalities, have merged into a county form of government control. So there is the majority that are appointed boards on the road commission at this point in time. I want to announce and recognize the 2026 Impress Award that was given at the Road Commission's annual statewide meeting. And at that meeting, Jason Root, Brent Dankert, Will Green, Scott Bates, and Eric Stoll were recognized for their innovation in taking a skidster and reconfiguring an attachment to clean under the guardrails, something that impressed the people at the Road Commission, and people were looking at that to see how they could duplicate that effort. So I want to recognize them. Road Commission is cleaning log jams. Currently, they announced at their last meeting that they're addressing Dodge Road, Dayton, and M24, cleaning out the log jams after the high water issue. Guilford Township resident complained at the Road Commission meeting about jake brakes and issues with sidewalks, limited sidewalks and speed limits. And the chairwoman suggested that the county should hire more police to monitor the speeds in the area. Road Commission deputy was going to visit the elevator issue to look at the sidewalks and address that issue as well. Road culverts were breached, as you know. Brent came to the meeting on Monday and talked about the intersections that were breached, and Dutcher Road is currently still closed. They're going to be doing shoulder grading and gravel on Bevins Road in preparation for the detour, M46 detour, where White Creek Road is going to be closed down and traffic detoured down 53 and up through Bevins Road. So they're going to be working on the shoulders. I noticed when I went through earlier in the week that larger stop signs were installed at Bevins Road and Deckerville Road, and flag markings were set where they're going to do the painting. Unfortunately, there was another accident at Deckerville Road, and so apparently the larger signs aren't making a great deal of difference, although I noticed that they were larger myself. MAC platform issues are being reviewed. I think everybody's reviewing their platform issues. I think I sent the agriculture and environmental out to everybody here. If you had any suggestions, because that'll be discussed at our next meeting. We went through part of them. Amish bridge issue we're still working on. And Parks and Rec, we are going to be interviewing candidates for the park host position. That's going to be scheduled. We have another meeting scheduled in May. And we did receive a preliminary report from Spicer Engineering on the site plan for the potential park out at the state property. And I attended Elkland, Elmwood, Akron, and Wisner Township meetings. Saginaw Bay Coastal Initiative is now Saginaw Bay Area of Concern. And they discussed the tributaries feeding into the bay and monitoring of specific bird species and water quality issues. So it's not quite the same as the group that it was before, but they're focusing on those things. That's it for me.
Okay. I didn't attend the Board of Health meeting last week. I had other obligations to do.
Commissioner Bardwell, I'm sorry, he's next.
Oh, I'm sorry.
Just get me.
Yeah, I don't feel bad now.
I figured I could remember that one name, but Mr. Bartle, but I didn't.
So I just want to circle back to Commissioner Barrios. You mentioned the larger signs. As we all know, there was another accident there. And interesting enough, I was in Walmart, and next thing I know, someone's yelling, "Are you a commissioner?" And you want to say, "No, it's my twin." Because that was a 45-minute discussion, which had a huddle. I thought maybe there'd be somebody moving us along, but related to those types of issues, what are we doing? Why aren't we doing, what's on the ballot? Who's going to run it? All these types of things. And Commissioner, I appreciate the fact that you requested a fact sheet. That's going to be very beneficial. We need to get that posted somewhere. I definitely need to carry some copies, but there's a lot of concern about Bird's Corner Road and the other roads. I mean, they're not really identifying other roads, but they have a huge concern, which leads into road patrol and many other questions. So it's a growing crescendo out there. Also, I just wanted you to pass on to Brent. Appreciated him coming down the culvert. That's a, I don't know how it was his idea, but that was very informative. And the fact that he did do that was very much appreciative. And as far as the Amish bridges, you're the only one that was out there at the meeting when we met. And I could not make that connection.
It was reported, yeah.
Yeah, in terms of what he would be responsible, they would be responsible for. So I just wanted to mention that. Related to my report out, behavioral health, the PCIP, the judge set it aside as a moot decision, which was basically the state taking over the care model of our locals and whatnot. It was not a very good idea, but they are back at it again, and they're creating another RFP, which they announced. So we expect that to come sometime in the future, which just means that from a mental health standpoint, the state is on a quest to take oversight of so many services at the county level. And that's just, there's that one. And of course, there's the materials management, and we can go on from there. So hopefully that will be negated once again. I think the best care model is the one that currently exists in the community. On the KLGA and TIFA, a lot of discussions related to the DDA and the TIFA. The board, the county pays our local TIFA about $120,000. And I know Angie's listening, so if I'm in error, you can step in, Angie, and straighten me out. About $218,000 comes from the city of Carroll, and the TIFA is through wherever there's a DDA within Tuscola County, they get some money. Some of the challenges that are being questioned is, are they following the TIFA tenets on how they spend the money? And that is an interesting question, but that's yet to come. And I know Angie will probably, as she has mentioned in a presentation, hopefully in the near future, related to TIFA and related to our obligations or non-obligations in the future. Related to that, the DDA is in the process of hiring a market manager DDA executive. And that is going to go in front of the city council. It was once advertised as separate part-times. Now it's going to the council to be combined. The exposure on that could be up to $90,000 to $100,000. So I just want you to keep that in mind, that the 120 we provide is part of that. So depending what the city council will do, obviously we need somebody from the market because it's going to start here shortly. But on the other hand, the DDA, we have to make sure, they have to make sure that they're aligned with the tenets of what the DDA is to do for downtown development. A lot of controversy related to that issue. So more to come. Related to economic development, Alicia was just in here. I just want to say between Jim Tussey and the board and Alicia is doing an exemplary job of meeting with employers and retention and working on grants. One of the top things, there's about 5 grants that they're administrating. They're going to concentrate. The concentration is going to be on grant finding and writing to get grants for the community, whatever need. Also the retention and visiting to see what's going on, because I see the Oasis is for sale. If you've not been by that, I think that's what the sign says on the tree.
I think so.
I think so.
I saw that this morning.
So get your hamburger quick. Unfortunately, that's a very old business, and I don't know what's happening there. And also the DDA, Chairman Vaughn, I think they've been working on the dam project, not the dam project, the dam project for probably 10 years. you've been involved.
Yeah, eight or nine.
8 or
anyway.
9?
Yeah.
So yet, what was decided, I was the sole vote against it, was to spend 13,000 for a study to see if there's any grant funding, and it was said that, well, because of all the attention on the dams recently, maybe we can get some funding. But there's been studies previously, this is a privately owned dam, and I just thought with the 120 we give the EDC, 13,000, I just was not convinced that it was going to have become anything other than shelfware. And that's just my opinion, but I would rather see it spent on economic development within Tuscola County, but needless to say, that was spent. Also, they hired a part-time grant oversight for the grants that they do secure. So that's a little bit of what's going on with DDA and Tifa. Once again, they're planning on coming in to show the board value added of what they're doing, and I'm looking forward to that in the future. Jim has been here. It's been a lot of reorganization, and as many of you know, the chairman knows, from a EDC standpoint, in the past, has vastly improved in terms of what they're attempting. We can't expect things overnight, but changes, but it certainly is on a road to value added. Another announcement was made that ownership was changed recently with Walboro. There was some question with Walboro in terms of its viability. Prior to that, I mean, it was rumored, but probably not. So the new owners, was reported, there's about 400 employees there, that plans on retention in Cass City. Could you imagine Walboro not existing? We have very few industries in Tuscola County, and our industrial base is waning. So that was reported as well. All good news, of course. The only other thing I'd like to report is the Workers' Comp Board will be meeting at the end of the month. We had a RAC meeting, but that's more broad related to, they called Rural Action Caucus, and I think I've commented before, it's more like Rural Metropolitan Caucus. They really don't get into too many rural activities, but still a good national committee to be on. That's all I have, Chairman.
Thank you. Now I think it's my turn.
It's your turn.
I've been trying to get in front of everybody else the whole day. After about 2 hours, I get brain dead up here. But yeah, I really don't have nothing to report on. I go to the health, Board of Health meeting and other obligations. And, Parks and Rec, that gives us updates on that. So I really don't have nothing else to go. We'll move into other business as necessary. The only thing I got is on the meeting May 14th, myself and Commissioner Lutz will not be able to attend that meeting. We can continue with the 14th meeting with 3 commissioners, or we can move the committee meeting to Monday, the 11th, so I have a committee of the whole meeting with the committee meeting to that date, or whatever you like to decide. But I have obligations. I cannot get out of it. Bill's in the same boat as I am, that we just cannot change it.
So you're proposing a Board of Commissioner meeting after the committee meeting on the 18th?
Just combine them.
Just combine them on the 11th.
Just have one meeting.
Oh, on the 11th.
On the
Yeah.
11th.
I see what you're saying.
Yeah.
Is that going to be when we recognize Sergeant Richardson? We're going to put him on the agenda for the May meeting,
We can, we'd have to reach out to see if he's available.
Medal of Honor. I know they're having a luncheon for him in June. I believe he's back in May.
I don't have an issue
I'm
with
good
that.
I'm good with the 11th.
So, George, we can make some changes.
Yep, I will post that as just a regular board meeting for the 11th, and then we'll not hold the cow.
Thank
Thank
you, Chairman.
Okay. With that being said, extended public comment. Anybody here wants to address the board? Time to do it now. You got 5 minutes to address the board. State your name and where you're from, please.
Good morning, everyone. My name is Jessica Wright. I live in Silverwood, Michigan, in the Shea Lake area. I have been for the last 10 years solid. The property was my grandparents' purchased back in the 70s. It was our summer home. We used to come up from Detroit every summer. Going up north was the thing. And when I graduated high school, I joined the Army, and my grandmother decided to move up here permanently. So long story short, fast forward to now, my grandmother, she's been gone 11 years now, and it's been my sole responsibility. I am a single woman. My grandparents raised me, but my mother, she was the only child, and she passed in the 90s. I'm an only child, so, and I don't have any aunts or uncles. It's literally just me up here. But I'm okay with that because my family that I do have in Detroit, trying to get them out of the city is like pulling teeth. And then they get scared up here in the dark. And I think it's so funny to me. I'm definitely certified country. I've been away from the city way too long and I can't stand it. So I'm here today because, you know, I spoke with Mr. Vaughn yesterday and he met with Miss Ashley. I missed the deadline with the foreclosure for the taxes. And unbeknownst to me, I didn't realize that they hadn't received that application. So I have been working with Ashley trying to show her, hey, I did try, you know, well before the deadline. But I believe that also too, that she thought that, you know, everything that I sent her was drafted. Well, in between trying to, you know, send her proofs and understand and read the Property Tax Act and all of these statutes, just trying to educate myself because I am also a legal assistant. I made the payment to satisfy that delinquent tax year. And it was kind of funny that like no one would mention the payment that I made. And I didn't know if it was thought, I don't know. That was me trying to do something to save the only thing that I have left. It was truly an honest mistake. I stay on my stuff pretty good. I'm pretty good at, I'm like the sticky note queen. And for me to have checked that off my list, you know, in my mind, I thought that we were good. When she said, you know, you can start paying $310 next month. Now, mind you, this was in March, meaning April. You know, I kind of ran with that. It wasn't until last Monday, I got something weird in the mail about a foreclosure. And I was like, or foreclosed home. I said, what the is this? Insert expletive. And I called the next day and she was like, no, I didn't get the application, and we went forward with the foreclosure. And I've been pretty much devastated ever since in trying to correct that. I'm hoping that, you know, since the auction hasn't been held yet, that the committee will show me mercy and accept my payment in full for that delinquent tax year. And I'm also prepared to pay more than 50% of the one that just went into forfeiture. Because frankly, it's been in this vicious cycle since she passed away. And I've been trying to pull myself out of it. I have never let it get to anything like this, ever, never. And I never want to be in this position again. Forget.
You know, and you did call me yesterday, just yet, and I appreciate your call. And I did follow up with what you said. I did have a sit down with Ashley. And we talked about everything, what's been going on, what's been passing. And there was a lot of deadlines that were not kept.
And that was what I found confusing, because
Yeah.
last year I just paid myself on the 31st, mind you. And the year before, I did attend the hearing and did it properly. You know, I know in the beginning I wasn't doing right because I didn't even understand the process.
And statutorily, Ashley is bound by dates and timelines and stuff.
I do understand.
You know, and that's where we're at right now yesterday. So when I called you back and I said, I've had our meeting, there was nothing that I could help you with because timelines have elapsed and, you know, come and gone. And again, statutorily, the treasurer has to stick by timelines. So I appreciate you coming to the board, telling the story. I feel bad as anybody on the board. I'll comment that. That's a bit.
No comment.
Look, Chairman, the only, with not knowing any of this, but the only recourse for this lady is what at this point?
That's what I would like to, because I paid and I thought,
There is no recourse as times have elapsed. And to the treasurer's office, if I make recourse here, I've got 500 people coming at me for the same recourse.
So the recourse I'm at is the only avenue that she has is she has to bid on her own house, is that
and
it?
try to,
That-
and I can't
At this point,
possibly
yes.
do that. But, and although it has passed, right now, as we stand here, as we speak, that property is still in my name because the deed hasn't transferred because the sale hasn't happened. So if I have paid the delinquent tax year, technically that year is not in delinquency. And, you know, like I said, as a legal assistant, I know that we are in the very early stages of this process and that it can be intervened because look, an honest mistake is gonna take my entire house away from me that.
We're at the very late stages of this process.
Well, I mean, the beginning of the foreclosure, it's still in pre-foreclosure because the auction hasn't happened.
Chairman, just help me, I'm trying to work this thing through. Just-
Okay.
Let's say that she bid on her own house, hypothetically, paid the sale price. They deduct the taxes, but don't they give the proceeds to the
Yes,
owner?
back to me. So it's like, I already gave you what y'all wanted, what you're gonna get in the end and made y'all whole. Because frankly, people say like, guys don't really want my house and trust me, you really don't. It's old, it's falling apart. There's a lot of problems. And of course, because you want to recoup your funds. I have since then actually given the funds and then some to make the county whole in that matter. And especially knowing, like the gentleman just said, that in the end, that's all that you would be entitled to get. I understand, trying to, you not having the door knocked down. Well, I don't think other people would fight as hard as me too. And, they would have just gave up probably a week ago. And I can't do that to my grandparents. I can't fail them like that. And especially knowing, like, this is something that you certainly can't fake, is showing when I made that file on March 18th at 3:25 to send it over. And I take responsibility in not confirming, but when I didn't hear anything, I thought everything was okay. So I would not have waited until that 31st deadline. I would have never let it get past that.
I have another question. Was that sent by mail or by email?
Email.
It was sent to the wrong, part here was sent to the wrong email address, and it was not received.
And I didn't receive the bounce back. So I called our IT and personally asked them, like, do you always get one? Because I'm looking like a liar here. And she said, no. I did offer for us to do like a 3-way call so she could hear that for herself. And by then, they tired of listening to me at this point, and I get it because I'm grasping at straws, but it really was an honest mistake. And like I said, and I kind of thought too, well, she thought that was, fraudulent. Then maybe she thought my payment was fraudulent, which is why I had brought Uncle Joe with me. Because that's a huge favor to ask somebody for that kind of money. And I'm used to handling things on my own. So I had to But it was a lot at stake. I just swallowed my pride there and asked him like, hey, I'm eternally indebted to you if you can help me save my house. So please, please. And I have already paid you, and I have another like 800 cash that you can have. You can have anything, everything, please.
Chairman,
As a,
I don't really know anything about the process. Maybe the board needs to be updated someday, once again, to see where we're at on these. But from a past precedent, legal aspect, have you researched in terms of remedies?
I mean,
Since you were a
outside of
legal
like
assistant?
filing, yeah, because like filing bankruptcy or, that kind of thing. But really it had been, waiting to bid on it and whatnot. It had been going that at this point. But that's why I paid it, because I talked
Actually,
to a couple of realtors
the
too.
treasurer, I'm just gonna be blunt here, the treasurer done everything in her power to keep this gal in her house, and I believe that, everything in her power. She set you up payment plans, she set
And
you
I
up.
always honored every single one.
That's been the issue, no ma'am, you have not.
Yes, sir,
And-
I have.
and
Otherwise I would, oh,
You
I
did one
absolutely,
time, but that was just a few days ago.
excuse me?
And you
That was a
even had a court date for the judge could extend your period.
So before
And you
then,
didn't show up for that.
no, so, okay.
So, I mean.
I
we can say
understand,
it all
because she
day.
said that too. She was like, well, why
You
didn't
know,
you do the show cause and this and that?
She
I
did-
had
she-
other arrangements. I should have started there, that my father, the one in Detroit, my aunt, they promised that they were gonna help me take care of this. It got to a point where it looked like I couldn't rely on them, and obviously they weren't coming through. Is why I contacted her office March
I
12th.
understand that, but I'm just trying to enlighten the board
Sure,
on
it's
everything
not
that's going
been
on
an
here.
easy road. It's been very
And-
ugly.
and-
She's definitely been a help.
She's done- she's
Absolutely,
done
I'm not
everything in her
discounting
power,
that
but
at
I
all.
believe after our conversation, going through different timelines that she gave you, different things that you were to do.
But for
And
this
is the first
specific
time-
year,
And here, coming
Yeah.
to the board meeting, it was the first time you showed up to what your obligation was to be. Ma'am, I appreciate you coming to the board and so if anybody else on the board has anything else to add, feel free to add what you want to add,
All right. I don't-
so my payment means nothing.
That you'd have to get with the treasurer on, but my understanding was that if you pay after a certain date, it doesn't get accepted because the system won't let it accept it.
It did
The times
it. Oh,
ran
it went
out.
through. It
Well, it's
said.
being held there somewhere. That's something
Oh.
you have to talk with the treasurer on and get that reimbursed back to you. Okay? I appreciate you coming in, but is anybody else on the?
I mean, as a you're another homeless veteran over a couple, and it hasn't gone all the way through. Like, we can intervene so that I don't lose everything, and the county doesn't lose any money.
There's a lot of people in the county, just because that's in your same situation. And essentially, like the treasurer said, if I make this exception, because she gave you timelines, she gave you dates, she gave you payment plans, she gave you forms to send her. Okay, you said that you did send those.
Neither
to all
one of
addresses.
us confirmed. She did.
And-
I didn't confirm
and
she received it.
Very concerned if she would
She never called
make
me
this
either.
exception
Can we both
after all
share?
this time, that she would have to honor everybody else's.
I don't. I
requested.
mean, I can't worry about everybody else. All
I
I can worry about
understand that. I'm
is me.
I'm just trying
you
to
know.
agree with you today, but again, unless the board has anything else they want to add, we appreciate you coming in, ma'am. Sure, your name, sir.
Eugene C. Carlock Jr.
What's the last name? I'm sorry.
Carlock, Carlock. I live in Kingston, Michigan. What I would like to just ask, due to a bunch of, I guess you would say, honest mistakes, trying to rely on someone years ago that did not come through, that later we found out was not dependable. But this recent thing, honest mistakes on maybe both parties, who knows? But you would actually sit a person out of their home, a veteran that has injuries from the military, and sit them out with their families, lifelong, everything in the house. That really seems unfair and un-American. Really, it does.
You know, and sir, to just respond to that, you know, I agree with you, and that's why I took Jessica's call. That's why when she gave her story, I say, I'm gonna go down, I'm gonna sit with the treasurer. I'm gonna find out the backstory of this. And I was there to help her if I possibly could. But again, the treasurer is bound by statutories too that she has to follow. And after talking with all the stuff that she went through, was what she said that she told us what she had to do to maintain her residence, to fill out the form, to show up in front of the judge, to ask for an extension. Out of all of this stuff, it didn't happen. So I feel, in fact, my words to the treasurer was too, hey, we got a veteran here. Is there anything we can do? I mean, you know, because I felt the same way.
I didn't
But
ignore
after,
the first
but after the talk that we had, it's strictly the treasurer's call for one, because she is statutorily bound. She's the one that has to answer to whoever is above her when it comes to this type of thing. And nobody feels worse than I do being a veteran myself. But, you know, I'm comfortable that the treasurer followed all of the protocol that she was to follow. And I appreciate you coming in, but again, this is strictly a treasurer's decision on my belief.
So there's absolutely nothing that can be done to stop this, to stop the auction or anything, or her being kicked out.
Sad to say, not at this time, no.
Okay.
Thank you.
Thank you.
Anybody else want to address the board this morning? With that, I'll take a motion to adjourn.
I'll make that motion.
I'll support.
So moved by Commissioner Cook, supported by, Mr. Commissioner Lutz, supported by Commissioner Cook, to adjourn the committee meeting this morning. Any more discussion on that? All in favor, say aye.
Aye.
Meeting is adjourned. With that, I want to open up the statutory finance part of the meeting this morning. And we'll have a roll call by Madam Clerk.
Thank you. Good morning, Commissioners.
Good morning.
Commissioner Barrios? Here. Commissioner Barbell?
Here.
Commissioner Vaughn?
Here.
Commissioner Lutz?
Here.
Commissioner Cook? You have a quorum. You may proceed.
Thank you. Action on previous meeting minutes.
Mr. Chair, make a motion on the action on previous meeting minutes, the statutory finance of April 16th, 2026.
I'll support that.
So moved by Commissioner Lutz, supported by Commissioner Cook, to approve the statutory finance from April 16th, 2026 meeting minutes. Any more discussion? All in favor, say aye.
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 Motion's been approved. Let's move on to new business. Review and approval of finance report checks.
Chair, I make a motion to review and approval of finance report and checks 4/30/2026 finance docket.
Support.
Been moved by Commissioner Cook, supported by Commissioner Barrios, to approve the review and approval of the finance report and checks for the 4/30/26 finance docket. Any more discussion? All in favor, say aye.
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 Motion's been approved. Review and approval of the data report and checks.
Chairman, to review and approve of the daily reports and checks 4/30/2026, the daily docket.
Support.
It's been moved by Commissioner Lutz, supported by Commissioner Cook, to approve the approval of the daily report and checks of 4/30/26 of the daily docket. Any more discussion? All in favor, say aye.
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 Motion's been approved. let's go to approval of the per diem report checks.
Chair, I make a motion to review and approval of the per diem report and checks April 2026 per diem.
Support. It's been moved to approve the per diem report and checks for April 2026 per diems. Any more discussion? All in favor, say aye.
Aye.
Motion passed. I see another under old business. Does anybody want to comment on statutory finance part of the meeting? Seeing none, the record show that that was offered, and with that, we'll take a motion to adjourn the statutory finance.
I'll make that motion.
I'll support it.
So moved and supported. Any more discussion? All in favor, say aye.
Aye.
Statutory finance